I feel sorry that they've had to do that. What I do know, though, is if everyone does the right thing in those communities, but right across Victoria, over the next month, we have an opportunity to get on top of this and get this under control. So the more people that comply with the restrictions and the enforcements, we know if you get good compliance, you can absolutely make a difference in relation to the spread of this virus. Most people have done the right thing throughout this period, but we now need people to, again, do the tough yards, particularly those hotspot areas, in order for us to get on top of this. Otherwise, we may see this spread even further across Victoria, and we will face both social and economic impacts as a result. Now, police don't want to be out there finding people. That's not what they really want to be doing. But be in no doubt, this is absolutely what they have to do. They have to be out there, they will be out there, and this will be a critical part of making sure we save lives and stop the spread of this disease. These have been really tough decisions for everyone to make. We know, and a lot of work went into, what are the right decisions based on the health advice we had. Tough decisions, but made for the right reasons. The right reasons, which is for us to be able to get control of this in the shortest period as possible and then to go back to a more COVID normal again. So I ask people again to do the right thing. If you don't need to do something, don't do it. I ask people right across the state to think about your behaviour as well. We're not out of this. Continue the social distancing, continue the rules that apply to you, continue the hand sanitation. All of these things mean that as a community, we can together get on top of this again. We can't afford complacency. So for those communities that where you'll see a big police presence, again, police are there as much to reassure you, but they will be enforcing the rules. So if you breach those rules, if you blatantly breach those rules, you will be fined, be in no doubt. And as I said, thousands of people will come in contact with police each day as a result of this new operation. Can I thank Victoria Police members again who, this has been a big year from state of disaster to state of emergency, and there is no doubt in my mind that police have played an absolutely critical role in saving lives, helping us stop the spread and helping communities get through the bushfire period. So to every police officer, PSO, every unsworn Victoria Police member, thank you for your work, and I know we've still got a long way to go and we're relying on you to continue that effort and dedication. Now I'll ask the Chief Commissioner to provide a bit more detail about Operation Sanus.
Good afternoon. Operation Sanus commenced today. It's an enforcement and a patrol operation, and it's going to be specifically targeted in those 36 suburbs that come within the scope of the 10 restricted postcodes relating to coronavirus COVID-19. It's a highly visible police presence, and it's about us making sure that people adhere to the Chief Health Officer that chose directions in relation to stay at home and restricted activities. As the public would already be aware, we have Operation Sentinel, which has 500 police officers all day, every day, out and about across the state, looking at public reassurance, but checking in making sure people who are isolating, who are supposed to be staying at home, are doing so, but also checking for breaches as well and enforcement in regards to that. We have Operation Shielding, so we have 20 shielding teams every day that comprise 160 protective services officers and 80 transit police officers working together, again looking at trying to see what we can do to make sure that people are adhering to the Chief Health Officer's directions. So in addition to those, with the launch of Sanus today, the new operation that's going to target those 10 restricted postcode areas, those 36 suburbs, Sanus will be drawing on some resources from Sentinel and Shielding, but in addition to that, we will also be having our public order response teams, our critical incident response teams, our mounted branch, our highway patrol and local police as well. All of those will be working together, and they will be out there to make sure people are adhering to the CHO directions to stop the spread of the virus. We will have today over 1,000 police out and about solely focused on coronavirus enforcement, patrols, visibility and proactive presence. That is a significant resource commitment. and they will be continuing on. Hundreds of those police are going to be in those specific suburbs, and they're going to be making sure people are doing the right thing. So what does that actually comprise for us? We'll be having police on those targeted roads, some back streets, some other roads, but also main arterials. We'll be having a high volume presence in those high volume public places. We'll have booze buses out and about. We'll have them in static locations for a period of time. They'll be rolling on throughout the shifts, throughout the day. People will not know where we will be. They will not know how long we will be there for, but they will be intercepted. People who are in those, especially in those restricted postcode areas, those suburbs, they can expect to see a very strong, visible police presence where they'll be pulled over, and we'll be speaking to them to make sure that they are supposed to be out and about, that they are adhering to the reasons for being out and about, and they are adhering to the Chief Health Officer's stay-at-home directions. Drivers and passengers can expect and should expect to see us, and the strong probability that they will be intercepted and asked where they're going and why they're going there. We'll be using our automatic number plate recognition technology, where we'll make sure that our officers out in their cars can see, they'll be seeing vehicles and they'll be knowing whether they're supposed to be in that area, whether from out of those areas, and so that will assist us greatly in what we're doing. As the operation progresses, we'll be looking at how we can utilise other resources from within the organisation, including potentially the use of drones in those public spaces to make sure that people are adhering to the public gathering reasonings and the directions of the CHO once again. So the public need to be clear. Travelling through here, if you're not from that area, or if you are in that area and you're out and about, the probability of you being intercepted, spoken to by police, and the reasons why you are there will be ascertained. If you think that's not going to happen to you, then it is. And we will be fining people. There is no doubt about that. I want to be absolutely crystal clear. For those who are selfish enough to disregard these warnings from the CHO, the deliberate, obvious and blatant breaches, if they're committing that, we will be infringing them. The window of police discretion is a very small window at the moment, I can assure you, and it's rapidly closing. While we may have been very lenient of recent times, with this emergency we're experiencing, with this threat to public health, the safety of the public, that leniency is dissipating day by day. I can assure you we will now be issuing the majority of people who infringe, who commit these breaches, with infringements. Very, very rarely will we be using discretion and warning them. Only extreme cases of ambiguity will we be doing so. You would have to have been on Mars not to understand that the Chief Health Officer restrictions apply in these 36 suburbs and that you're expected to adhere to them. So for those reasons, I've instructed all of our officers that that window of leniency, it may exist on some very small few occasions, but other than that, people are expected to get tickets for $1,652, because it's up to us to make sure that those selfish few who aren't adhering to the guidelines know there are consequences, and by doing that we can help stop the spread.